Welcome to Med in 5. The goal of our channel is to simplify medical concepts and help you understand them in minutes. Today, we're tackling Hepatitis B virus, the only hepatitis virus with DNA in its genome. Try these cues before we start. What enzyme does HepB use to copy itself? What's the most common presentation of acute Hep B infection? What HepB protein, made by recombinant technology, is used in vaccines? Stay tuned. The Hep B virus, a hepatadenovirus, is the main cause of Hep B infection worldwide. It's an enveloped virus with an icosahedral capsid and a unique partially double-stranded DNA genome. Only the minus strand is complete. The plus strand is incomplete, but completed during replication. Hep B is the only hepatitis virus with DNA, as others have RNA genomes. Unlike herpes viruses, Hep B doesn't establish true latency but can integrate its DNA into host liver cells, contributing to chronic infection and cancer risk. Hep B spreads via infected blood or body fluids, commonly during sexual contact or exposure to contaminated needles. Mothers can also transmit Hep B to their babies during delivery. High-risk groups include sexually active individuals, IV drug users, healthcare workers, and infants born to infected mothers. Key virulence factors include its ability to integrate into host DNA, evade the immune system using surface antigens, and produce viral proteins that disrupt normal liver cell function. After exposure, Hep B surface antigen appears within 1 to 9 weeks. Most patients are asymptomatic during acute infection, but fatigue, fever, nausea, jaundice, and abdominal pain may occur. Patients can transmit the disease at this time. Most healthy people clear the virus within 6 months, marked by the disappearance of HBsAg and appearance of protective anti-Hep B surface antibodies. Persistence beyond 6 months signals chronic infection. During this phase, HepBe antigen, produced from a starting region in the virus's DNA called the precore, indicates active viral replication and higher infectivity. Anti-Hep B core IgG remains positive for life, showing past or ongoing infection. The core refers to the virus's inner protein shell that surrounds its genetic material. Chronic infection can cause persistent liver inflammation, producing symptoms like fatigue, jaundice, and abdominal pain. Chronic hepatitis can result in cirrhosis, where scar tissue replaces healthy liver cells, causing dysfunction. Cirrhosis presents as fluid buildup in the belly, called ascites, bleeding problems, and swollen veins around the navel, called caput medusae. Ascites and caput medusae result from liver scarring, causing high blood pressure in liver vessels. Low albumin production by the liver contributes to ascites, which may progress to anasarca, or widespread body swelling from fluid buildup. Bleeding problems arise from the liver's inability to make blood clotting factors. Manifestations include hematemesis or vomiting of blood, melena, with black, tarry stools, easy bruising, gum bleeding, prolonged bleeding from cuts, and others. Bleeding can be fatal if uncontrolled. Cirrhosis also elevates the risk of hepatocellular carcinoma, a type of liver cancer. Symptoms include weight loss, constant belly pain, and worsening liver function. Most acute Hep B cases are asymptomatic or show nonspecific symptoms, so diagnosis requires detecting HBsAg within 1 to 9 weeks, indicating active infection. Anti-HBc IgM signals recent infection. Anti-HBs indicates recovery or immunity. Chronic infection persists beyond 6 months, with HBeAg showing high viral replication. Monitoring these markers guides treatment and tracks disease progression. Treatment depends on viral activity and disease stage. The presence of HBeAg and high HBV DNA levels suggests active replication, warranting antiviral therapy. People with chronic infection but low replication may be monitored without immediate treatment. Loss of HBsAg and appearance of anti-HBs usually indicate recovery, requiring no therapy. Prevention relies on HepB vaccination, with recombinant HBsAg given as a 3-dose regimen starting at birth, as well as safe sex practices and blood product screening. Managing immunosuppression reduces transmission and reactivation. Let's review. What enzyme does HepB use to copy itself? Answer: reverse transcriptase. What's the most common presentation of acute HepB infection? Answer: most are asymptomatic. What HepB protein, made by recombinant technology, is used in vaccines? Answer: HBsAg. Everything checked off? Bravo! Found this clip useful? Tap like, share, and subscribe. Check out the summary table from the link in the description. Thanks for watching.